Listeria monocytogenes. Now this is one of the important foodborne pathogens to remember, and this is a gram-positive cocobacilli. Now having said that, what is so peculiar about Listeria monocytogenes? There are very lot of peculiarities, especially when it comes to the various methods of isolation of Listeria. Now there's a question that was asked, which of the following is true about Listeria monocytogenes? Pregnant women are at high risk, infants at high risk, elderly at high risk, infection transmitted by inhalation route, ampicillin is the drug of choice. So the given question here is asking about which of the following are the high risk groups. Yes, all three of them are considered to be the high risk group because it mostly affects the extremes of age. Infection is transmitted by inhalation? No, because it is a foodborne zoonotic pathogen. So it's a foodborne organism. So it's usually the main route of transmission is by contamination. So it's contaminated food. Most common route is contamination of food. So it is not anything that has anything to do with inhalational route. So contaminated food is the important one to remember. Now pregnant women are at high risk, and from pregnant women to newborn child there is a risk of vertical transmission. So in pregnant women there is a risk of vertical transmission as well from the mother to the child. So these are the various things that you have to remember. Now talking about the drug of choice, yes, ampicillin is a drug of choice. So this is a PGI question, hence multiple options can be correct. So A, B and C are the correct options as well as E, but D is the wrong option because it is a foodborne pathogen. So it is a gram-positive cocci bacilli, so it's typically what is known as cocobacilli. So it's a gram-positive cocobacilli. Now it shows a type of motility which is known as tumbling motility, and it has a peritrichous flagella. Now coming to the culture, blood agar is used for culture, and most of the times you see beta hemolytic colonies in blood agar. Very typically seen are beta hemolytic colonies. Now chocolate agar is used for isolation as well, along with a medium which is known as Palcum medium. So this is a selective medium that is used for the isolation of the organism, and this mainly consists of antibiotics like polymyxin, ceftazidime, along with lithium chloride, mannitol, and also esculin. So various substances are made to what is known to be as Palcum medium. Cold enrichment method. So this is to isolate the organism better, where you take trypticase soy broth. So this is what is used for it. So trypticase soy broth is taken and you inoculate the organism and refrigerate it at 4 degrees centigrade. This is then subcultured on Palcum agar or blood agar and incubated at 37 degrees centigrade. So after incubation you will be able to see the colonies, and this is very typical of Listeria. Now it is Antin test, CAMP test and catalase test positive. So it is one of the organisms to remember when it comes to catalase test. So it's a catalase test positive organism. Now it's also Antin test positive. So what do you mean by Antin test? So when you put a Listeria culture into the eye of rabbit, you tend to see changes which resemble a keratoconjunctivitis. So this is known as Antin test. And coming to CAMP test, so it is nothing but whenever you streak Staphylococcus aureus and then the suspected Listeria monocytogenes at right angles, you see an enhanced arrow-shaped hemolysis. So this is known as CAMP test positive, and this is also another organism to remember for CAMP test. So if you can notice it here, what you see here is nothing but an organism with peritrichous flagella. So drop-like colonies seen on blood agar, usually beta hemolytic. You also see growth on chocolate agar as well as Palcum medium. So Palcum medium, like I told you, is the selective medium for it. Now coming to the manifestations, the most common or the most important manifestations that you see is what is known as neonatal listeriosis. Now it's divided into early and late onset neonatal disease, where the early onset occurs in less than 5 days of birth and the late onset occurs after 5 days of birth. Now this is acquired from maternal genital flora, so this is basically by vertical transmission, whereas late onset neonatal disease occurs from environment. Now this is associated with obstetric complications. So you see various obstetric complications like premature rupture of membranes causing preterm and chorioamnionitis. So these are the various obstetric complications which you commonly see. Whereas in the late onset, there is no obstetric complication that you can see. Now coming to the most common presenting clinical feature, or the most common way that it presents, is as a neonatal sepsis. But when it comes to late onset, it always presents as meningitis. And you also see what is known as granulomatosis infantisepticum. So here you tend to see microabscesses. So there are lots of microabscesses that are seen, and these are normally seen in liver and spleen. So microabscesses in liver, spleen as well as skin are commonly seen, and the same features is absent in the late onset neonatal disease. Now mortality rate is very high in early onset, whereas it's relatively low in late onset. Now this does not cause nosocomial outbreaks, whereas when it's from the environment, it usually causes nosocomial outbreaks. That is, many children can be affected in an NICU because of Listeria. Now important points to remember, like I told you, granulomatosis infantisepticum, which is seen in neonates, especially in the early onset. Now meningitis, again late onset, it's also seen in adults. Chorioamnionitis is seen in pregnancy, and you see prom or premature rupture of membranes, which causes preterm births or abortions. Now sepsis is also seen in immunocompromised. Now many a times immunocompromised patients present with sepsis, and one of the most important conditions or the risk factors are steroid therapy, HIV as well as malignancies, and the drug of choice is what is known as ampicillin. Listeria shows differential motility. So differential motility is the organism shows tumbling motility at 20 to 25 degrees centigrade. So at this temperature, it shows the typical tumbling motility, but at 37 degrees, it becomes non-motile. So this is known as differential motility, and this is because of temperature dependent flagellar expression. So differential motility is an important point to remember about Listeria monocytogenes, and this is in fact all the frequently asked points about Listeria monocytogenes.